And at this time, I will ask Deacon Ferdinand Luke, a member of the Education Committee, to offer invocation. Following him will be Mr. Isaiah Rumlin, the president of the Jacksonville branch NAACP, who will bring greetings. And then Mr. Hank Rogers, who is the co-chair of the Education Committee, the moderator, will begin the introduction of the panelists and then the discussion. As I said, I'm sure we all people of prayer. So right now, we will hear from Deacon Jaluk, who will give us the invocation.
Let us pray. Dear Heavenly Father, once again, we're so thankful that you've allowed us to live another day. And so because you have allowed us to live another day, Lord, we're asking that your spirit will permeate our very being. We thank you, O Lord, for the guidance that we received so far from Dr. Green and Brother Jones, and that we ask that you continue to bless them, God. Give them that discerning spirit. We will be trying to purport and do all kinds of things against them. But God, we call upon the name of Jesus, who will give us the strength and the discerning spirit. So bless them, God. And then we ask for those that are panelists on this event, that indeed you would bless every last one of us, that we try to do the things that would be pleasing in your sight. Lord, we all want to know better what can be done for our children. So God, we ask that you continue to bless us, continue to allow us to be a shining light on a hidden hill, because we know you are the one who will help us through all our many trials and tribulations. In Jesus' name we do pray. Amen.
Amen.
Amen. On behalf of the Jacksonville branch NAACP, I would like to greet you to this virtual town hall meeting as it relates to the reopening of our schools. And I think we as parents, grandparents, have to be very cautious about blindly sending our kids back to school, especially given the COVID-19 spikes and the disproportionate Black death in our community. The NAACP recently did a poll, national poll that is, and found that 80% of those polled preferred to hold off on ending the shutdown to assure their safety ahead of boosting the economy. Public schools should not be reopened unless all centers for disease control, protection, and indicators based on symptoms, based on cases, and based on hospital readiness measures are satisfied. And we look forward to hearing Dr. Green as it relates to the reopening of our schools, but that is just some of the things that the national office is doing on a national level as it relates to reopening these schools. And we look forward to hearing from the panelists. Hank?
Good afternoon, everyone. It is an honor to serve tonight as your moderator for tonight's virtual town hall meeting as we partner with the Friends of Northwest schools, Jacksonville schools tonight. Tonight, I'm honored to introduce our panelists and those who will serve with us. First, we have Dr. Diana Green, our Superintendent of Schools, Chairman Warren Jones, former school board member Dr. Connie Hall, Mr. Ken Emanuel, who served our district for more than 30 years as Assistant Regional Superintendent, Ms. Tamika Gaines Holly, who serves as one of the chairs of Friends of Northwest Jacksonville Schools, Ms. Monique Tooks, who serves and graduated from Parents Who Lead. She's also the vice chair of the DAC, District Advisory Council. And I'm not sure if Mr. Winston Seabrook has joined us, but he is the incoming president there at Joan Rebolt Senior High School, class president. of 2021. Let me first begin before I turn it over to Dr. Green and Chairman Jones by saying that the NAACP, along with the Friends of Northwest Jacksonville Schools, definitely support our teachers and their opinions and what they bring to the table. And so we recognize, unfortunately, there is not a current teacher serving on a panel, and that is because at this current time, the school district and the union, DTE, current negotiations at this time. And because of those current negotiations that's happening, it cannot be compromised at this time with anything that may be said. And so that is the reasoning for that. We welcome, of course, your comments. If you would be ever so kind and put your comments into the chat, we will definitely get to every question and try to get as many questions answered tonight as we can. At this time, I am going to turn it over to Chairman Jones to bring remarks. And after you hear from Chairman Jones, then I will turn it over to Dr. Diana Green, our superintendent, to bring remarks and talk about the reopening plan. Chairman Jones.
Thank you. Appreciate that. Appreciate the opportunity to be here, join you virtually. We have some difficult choices to make when it comes to reopening the schools. There are parents who are anxious for their students to return to in-school learning. There are parents who are fearful and don't want their kids at all in a brick and mortar building. There are parents who want their kids back in school, but they're concerned about the virus. And I spoke to one parent who said that, you know, I want my child back in school, but if he gets the coronavirus, he got to stay home and I got to stay home with him. So I'm still not with him. So we have choice. Dr. Green outlined a very sound reopening plan, which she's already done. Unfortunately, the Education Commissioner has required that we open 5 days a week, and I don't think that's where we're headed at this time. Reality is we should not be reopening until we have lowered the incidence of coronavirus in Duval County down to less than 2 or 3%, so you can effectively trace those who have contacted the disease. But we may not have that option if we're required to reopen 5 days a week. So I want to thank you all for being engaged. Thank you for the opportunity to be here. Thank you for your support, and I look forward to the discussion. Thank you.
Thank you so much, Chairman Jones. Dr. Green?
Good evening. Thank you to the NAACP for hosting this town hall meeting and giving us an opportunity to share some information. If you've been watching our school board meetings, I presented our reopening plan at the last school board meeting, but at the same time also requested that they have a conversation about a delayed start. And when that conversation went to a delayed start, I recommended to the board that I needed to bring this plan back because we have to negotiate with our union if we're changing the school start time, if you will, because it support our reopening plan, the one that was in its current form with the hybrid, with certain levels coming to school on certain days, also offering Duval homeroom, K-12, and DVIA.
Will teachers have an option to teach from home, or are they required to be present in the building every day?
Well, that's one of those conversations that we're having with our union at this time.
Okay. Dr. Hall, I'm going to turn questions over to you if you have any, or if not, then I will continue with the questions from our audience.
Thank you, Mr. Rogers. I think just one question. Good evening, everyone. I'd like to just backtrack for just a moment to look at how we got to where we are today in reference to the executive order. And the executive order that makes absolutely no sense when we have rising infections. That concerns me because we know in educational settings, it's high contact. You can't get around it. And to play politics once again on the backs of kids and our employees is totally, totally unacceptable. Having been a long-time educator, it's really getting next to me that this environment is being handled the way that it is. So I think as a community, we need to step up and address that to end playing politics on the backs of our future. The other thing that concerns me, I think, is on the facility side, where we moved forward, knowing that we have the oldest schools in the state, and that air conditioning, it can break down at any time in any classroom that has an impact on ventilation. So how can the school district, Dr. Green, effectively mitigate the risk for staff and students, and specifically those that may have underlying health conditions? And please include like the cleaning protocols, the isolation protocols. Will there be trained staff that can do contact tracing? Just all of that in order to have a healthy learning environment, which to me at this point in time, I see it as an impossibility. And I know you guys are doing the best that you can, because that's what educators do. But in the meantime, if you could address that question, please.
Well, that question has many parts. And I would like to say something cute aside. Every time I'm on this panel, I don't see anybody else, any questions directed to other panel members, but I'll take this one.
Well, who else is there? I'll ask them something too.
We don't have any answers, Dr. Green.
I will not disagree that we have indeed a great challenge, because we do have some of the oldest schools in the state of Florida. But besides having some of the oldest schools in the state of Florida, we have a budget that it's not built for spending it on supplies that aren't tied to what's directly happening in the classroom. But we have been very fortunate to have a maintenance department and a finance department that has assisted us in purchasing all the resources, supplies, PPE, that we feel very confident that we're probably one of the few districts that when we open really has the resources in place for all of our employees and supporting our students, whether that's a face shield, facial covering, or being able to go through all of our schools and use this product that kills bacteria for weeks on end. But it will be a challenge for us because, again, every school is not the same setup. I have some schools that it's not going to be a problem to move their desks 6 feet apart, and they have large hallways, and we're not worried about how students transition. Other schools that, even though the school is required to develop their plan, the district will have to come in and support that school. We are doing school walkthroughs. Under Paul Suarez, he is currently walking every campus trying to determine what would be areas of weakness that we need to address prior to school opening, as well as working with our finance department to ensure that even though today we have everything, what happens 3 months from now? Will we still have enough resources in place to support our schools? One of the biggest questions I get all the time is, are you sure you have enough soap? That is something that is relatively mundane, but it is very important because we've required every elementary school to have a hand washing schedule, that they're washing their hands almost every hour, and making sure that if we're requiring that, do we have enough soap to get us through the first semester of the school year? So every day we have this checklist that we go through to figure out, okay, what schools today do we need to put on the docket as these are areas of concern, and how do we support these schools? This board, Chairman Jones, I think can attest, has been very supportive. They've been right there in the beginning when we were probably the first district that said students were going to be required to wear facial coverings, and they heard from the community, and it wasn't a positive interaction, but they supported the recommendation that we needed to purchase close to 200,000 facial coverings, so that we would ensure that our students, who we know we cannot social distance on a bus, there's just no way to do it, that they were going to have that level of protection. So whether, the agreeing with the executive order is a position that the board will have to make decisions on, but right now it is the requirement that the state of Florida is stating, and we are requesting a waiver because we are requesting that we don't have to meet the 5 days a week. That is why we worked pretty hard to try to put in this hybrid model to get us through Labor Day or the middle of September before we are required to implement the executive order of 5 days a week in class.
So Dr. Green, to that, and then I'll ask Chairman Jones the same question. Are we starting the school year with a hybrid model, or will it be completely Duval homeroom? Do we know how the opening of schools will look at this current time? And I'll go to Chairman Jones first.
Well, that is what's being presented Thursday.
Okay. So we won't have an answer at this point.
Correct.
Okay. And I see our student has joined us, Mr. Seabrooks, and then I'm going to go to Ms. Tooks. Mr. Seabrooks.
How you doing, Mr. Rogers? First off, please forgive me for being late. I'm so sorry.
No, you're good. Do you have any questions at this time as it relates to the reopening of schools for our panel, or Dr. Green or Chairman Jones at this time on this?
No, sir, not right now.
Thank you. Thank you so much. Ms. Tooks?
And Dr. Green, I don't want to make you feel like you're on the hot seat. So if, you do have all the answers. However, the biggest thing in talking to parents, one of my main things was not to come on and speak just personally for me, but I do interact with a lot of parents and families. And you reference getting a lot of questions about soap. One of the reasons, I won't say this is the main reason, but one of the reasons is, believe me, we hear what you're saying, but boots on the ground, parents in the schools, prior to this pandemic, that has been a major issue in our schools. every time I go to the district office and I have to use the bathroom, I never have to worry about having soap. I never have to worry about having paper towel. In our schools, different story. We heavily utilize hand sanitizers. And if you know anything about in terms of sanitation of your hands, hand sanitizer alone is not working. So the reason why you're probably getting inundated with that question about soap is because the fact of the matter is, while we hear you saying it's going to be, and you're going to have these schedules and the actual implementation of that seems to be very different a lot of times. And people are very concerned when we hear a plan that talks about the protocols of cleaning or whatever. It stands to reason that one of the concerns that we as parents would have for those who are willing to even have our children in a brick and mortar would be the fact that where the custodial service has been in the past, we can only account for what has been in the past. And so now cleaning services, a lot of them have gotten certifications for COVID. So while I hear what you're saying, I guess the comfort zone for us is truly the implementation. Not necessarily, it's great that you have a plan, but really what is the accountability of the implementation of that? Because that's very serious. And in a lot of places, you may have schools where they're on it. And like you say, you may have your problematic. It's that 1% or maybe higher that may not be doing what they need to do. That will be an Achilles heel. And we see that on the daily. So it may seem mundane to ask about soap, but believe me, when you're in schools that they don't have it, they did not have it, and now all of a sudden here, because we have a pandemic, we have soap, that's why you're being asked that a lot. And it's really real. And that's a concern that we hear a lot, but the actual implementation and how are these schools really going to be held accountable for that, for making sure that they are following these wonderful protocols?
Well, that's why we have principals, and they're the ones in charge of the school. The regional superintendents have been meeting with our principals for a number of weeks about these protocols and the things that will be in place. When I hear about soap, a lot of it has to do with, the interesting things students do when they go into the bathroom. And
That's true.
yeah, I'm just going to leave it at that. And a school may choose, okay, I'm just not going to replace it since you felt it was fun to just unscrew it and dump it all in the toilet or throw it around with each other. So right now, our goal is to emphasize the importance. We have training that will be required by all staff members prior to school opening, that will talk about the training with PPE, the training of hand washing, anything that is related to the protocols. We're trying to develop that training, and not only for our employees, but also for our parents and students. So our goal is to have training on how do you take care of your facial covering. Let's have another conversation about going to the bathroom. It's very important. Wash your hands and wash them for 20 seconds. And don't decide that soap is, because it's so easy, to throw it down the toilet. Because again, the goal is to ensure that it is available and that we're not going to get constant phone calls, there's no soap at X school. And by the way, we do hold them accountable because someone follows up every time I get a phone call about there's no soap.
Dr. Green, too.
We do follow behind those phone calls.
Dr. Green, real quick, because I see this question coming in a lot, and I think it's a quick question to be addressed. Has custodial staff been increased at this time in the schools?
Custodial staff has been redirected. We want more custodial staff during the school day while individuals are in the building, versus when most of our custodial staff, they generally work in the evening. So the goal is to have more staff during the day so that any area that isn't covered by that particular spray I talked about, those things are taken care of.
Let me go to Ms. Gaines Holly for her question, and then I'll go to Mr. Seabrook for his question. Ms. Gaines Holly.
Thank you, Hank. And these questions are for Chairman Jones. One, I completely understand everyone's concern, including the board and superintendent, and of course, parents and teachers concerned for safety, because we are in the midst still of a global pandemic and cases are continuing to surge. So what we need to make sure that we're able to maintain safety and a safe environment and healthy environment, costs, of course, are going to also increase. Have we identified or know if we're going to get any additional funds to be able to pay for the needs that are in place, whether that is additional equipment, the plexiglass we talked about? Have we identified if we need those funds, are we getting additional funds, and where those funds will come from?
Very good.
Chairman Jones, while you're answering that question, if you would, while these questions are coming in, I'm trying to catch as many as I can. Would you also address, will the district, or is the district considering hiring an outside cleaning company to assist with cleaning some of the schools as well?
Okay, I'll start with the last question first. That's operation, that's Dr. Green, but I will say that there are no plans at this current time to hire additional staff. As she pointed out earlier, we plan to redirect some of the staff who comes in after school is closed or over, classes are over, to come in to work during the day to help maintain and keep it clean as possible during the school hours. So it's a redirection, not an additional staff, but just kind of redirecting, having maybe one or two additional staff people working during the day when classes are actually ongoing. Ms. Holly asked a question about the funding. We back up a couple of months when Dr. Green first proposed, as she pointed out earlier, to purchase 200,000 face coverings. There was a lot of pushback in some neighborhoods that was an excessive amount of money to spend for face coverings. But if we had not acted when we did, we probably wouldn't have been prepared to open school on August the 10th, because we wanted to be prepared in case the numbers did increase and we were required to reopen schools on August the 10th, which now we know that is the case. I asked people to be patient. As Dr. Green and many others have said, it's a very fluid situation. We were planning to have a plan presented last week, and then of course that changed on Monday when the Department of Education required us to have schools open 5 days a week. Keep in mind that we're still planning to ask for a change, having a hybrid plan and not 5 days a week. We're not sure at this point whether DOE will approve that plan. We're hopeful that it will, because Dr. Green pointed out, we're the only county in the state of Florida out of 67 that will have anywhere from 7 to 20,000 folks, depending on what numbers you hear from the RNC, in our city for 3 or 4 days. And we're not sure what impact that will have on the number, the spread of the coronavirus. And we also have parents who are essential workers that need to go to work, and they want their kids in school. So there are so many areas that we have to consider. And I think Dr. Green has done, and her staff have done a wonderful job. I tease her and Dr. Green and Terry Brady that when they finish with this school reopening, they can write a book and go on a book tour on how to reopen the school during a pandemic. It's never been done before. So we are on trading on unstable waters, and we don't know what will happen from day to day, but we hope to be prepared, and come Thursday, we'll try to make the best decision we can for our students and our teachers. Thank you.
Thank you so much,
sorry,
Chairman.
did the question?
Oh,
so
okay.
have we identified the
I had made some notes and I forgot all about your question. Thank you. Yes, we will get funding from the CARES Act, and we hope to pay for all of the things that we had to purchase in preparation for school reopening with the funding we get from the CARES Act. It's I think around $35 million, but that has to be shared with charter schools and private schools. So we still hope that we can cover the bulk of all of the costs from the funding we're getting from the CARES Act. The masks, the shields, the soap, the paper towels, hand sanitizers, all those items we hope to cover with the additional funding we get for the CARES Act. Yes, ma'am.
Ms. Gang, Holly, did that answer your question?
It did. It did. When it said shared with charter schools and private, is there a formula of how that is supposed to be shared?
Yes, there's a formula, and I'm not versed on that. Perhaps Dr. Green is, but I'm not. But that there is a formula that we use, and the bulk of it we come to the district because we have most of the students in the county. But there is a sharing formula. Yes.
Thank you so much.
Mr. Rogers, the sharing is based on the way we share Title I funding. We're required to share Title I funding with private schools and charter schools. And so that funding formula was applied to the CARES Act.
Thank you, Dr. Green, for clarification. Mr. Seabrooks, you had a question?
Yes, sir. So I wanted to, the question is to Dr. Green. So I know, Dr. Green, that you were wanting to, prevent, low traffic in the schools. And I go to Ribault High School. Ribault's very spacious, but I can remember when I went to Raines High School, my 10th grade year. And Raines, as it pertains to transitioning to classes, Raines is a very close-knit school, very, very small. And transitioning to kids, I know when I was there, we had only 5 minutes to get to class. And those hallways, all the students that went to Raines, that population of students, they had those small hallways. That's a lot of, a lot of traffic and a lot of movement, people touching up against each other and everything. So I wanted to know, I know you said, you probably answered my question already, but is there a plan to how, how the district will work to, how will they control the movement of students as it pertains to transitioning? And also, I wanted to know, did you, Dr. Green, add 7 blocks to the school day for 5 days a week, like how we would have 4 classes every day? Will we be having 7 classes in one day, every day?
Well, to answer the first part of your question, that's why we were recommending a hybrid for high school. The students would only come to school 2 days a week. That would cut the campus in half. So you would only have 50% of your normal student body on the campus any given day, so that you could have students move a little freer through the hallways, and the hallways were not going to be jam-packed. Our concern is actually less when they're in the classroom, because they're supposed to be in one location and they should pretty much stay in that location for the most part. But for high school students, we knew that we could not have teachers move and students stay stagnant. And it's because every 9th grader doesn't take the same subject. Every 9th grader doesn't have the same teachers. Some 9th graders are taking biology while other 9th graders are taking physical science. So we had to develop a plan that we were going to reduce the total number of students on a campus by 50%. And that's why we developed the hybrid, where students would only come, high school students would only come to school 2 days a week. And on the days that they're not there, they would be on Duval homeroom. We did move, some schools did move to a 7-period day. And the purpose of doing the 7-period day and keeping the same staffing was, the goal would be to somehow reduce their class sizes. We have some class sizes at high school that are 30 and 40 students, especially if it's not a core class. Our core classes, we try to keep at 25. So if we move to a 7-period day, yet kept the same funding for an 8-period day, that would give schools an opportunity to reduce some of those classes and have smaller numbers of students in a class, as well as instead of having students take 8 classes, they were only going to take 7. So it did reduce 1 class for the year, knowing that some of the complaints I got last year, especially from high school students, was that the workload was tremendous when we went to complete Duval homeroom. And by having 2 school days, the hope is that 1, the class sizes will be smaller. 2, you'll have an opportunity to move out of these rooms. You talked about Rains High School. Rains High School has no windows at all. And so it is going to be challenging to say, I'm going to keep you in that 1 classroom for 90 minutes. So the goal was to, in some of our schools, be able for students to have that opportunity to move, but have the campus reduced by 50% so that they have more room to move around, and that they would have the opportunity to spread classes out so that students can actually go outside. Our whole goal is about students going outside and having that fresh air, and because the research continues to tell us that you're less likely to transmit those droplets through movement. Also addressing the 7-period day, it is a different planning setup for schools, but we also understand that as we received information last year, the workload became quite heavy for our high school students. And the goal is to, again, treat each school, the culture that each school has is a little different, and we tried not to come in with a cookie cutter approach saying this is the only way you can do it and this is how everyone's going to do it. We worked with each high school and their schedule and their school-based administration to find the best way to support each school. So I did talk a little bit about the hybrid model before you came on.
And I'm going to go to Mr. Manuel, but let me try to get to a couple of more questions. It is now 7 o'clock, and so I want to make sure we honor your time. What happens if Dr. Green, a teacher gets sick, a student gets sick in the building? How is that going to be handled as it relates to the protocols? What protocols will be in place with the Florida Department of Health, the local health department? Can you speak to how that happens if a student gets sick in the building? Will they be quarantined? How does that look as it relates to the reopening of schools?
Well, every school is required to have an isolation room. Every school is required to have a room for students that exhibit one of the symptoms that is on that list. But we already had protocols for communicable diseases. Most people don't know, we had an outbreak at one of our elementary schools last year of all of a sudden, whatever it was, the outbreak was, I've completely forgotten, but we implemented that protocol. The students were all isolated. They were all sent home with the requirement of no return until a doctor had given them clearance to return. In that particular instance, we closed the school down for half a day, did a deep clean, and students were able to, fortunately it happened on a Friday, we closed it down, and then students were able to return on Monday. That same protocol would go into place for whether it's COVID-19 or any other communicable disease for students. We are working, again, this is another, when we're talking about adults, this involves the union. So we are working with them. What does that mean? We are working with some other organizations to help us with testing, and we are developing a plan with DOH with contact tracing so that we can do a very good job of tracing who that student's been in contact with, who that employee's been in contact with. And what most people don't know is we've been doing it for the last 2.5 months. We've been working with DOH with our own contact tracing team. And that team does all the legwork, and at the end, a decision by DOH has been given. And all of the people who are on, I'm just going to say, a contact list, they are notified, they are contacted, and DOH determines whether they need to go into quarantine or self-isolation, and for the number of days that they need to be in self-isolation. And we,
if an elementary student, for example, they catch the virus, they have a sibling who's in middle school and high school, is the family or is in quarantine, or is that left up to the local health department to make that determination?
well, that determination will be based on the contact tracing that our team along with DOH will determine. More than likely, if you've had prolonged exposure, which means generally if you're living in a house, that's going to address everyone who's had prolonged exposure to that particular student.
For our parents who are on the line, they continue to ask the question, can you identify or clarify the difference between Duval Homeroom and DVIA at this time?
Yes. DVIA is our district's virtual school. It is a K-12 school that is done virtually. Instruction is generally asynchronization. And when I say asynchronization, that means the student gets to work at their own pace. Although they have a teacher and the teacher works with them, they work at their own pace and they're actually enrolled in this school. So that school has its own school number. And so if I was a student and I attended High Grove Elementary and I want my child to be in DVIA because I didn't feel comfortable sending them back to High Grove, I would withdraw from High Grove and enroll in DVIA, and I'm now a student. The district does not get paid for that student if the student doesn't complete. And we only get paid based on completion. And so if you're an elementary student, completion means you completed 180 days and you have grades that for the first, second, third, fourth quarter. Duval Homeroom is instruction being delivered virtually. It's instruction from the school. When we did it over the spring, it was from that direct school. So I'm a teacher at High Grove, let's just use the same school. All the students were receiving instruction from their classroom teacher, but they were doing it from home. It was being delivered virtually. Duval Homeroom for this upcoming school will be synchronization, meaning live instruction, meaning the teacher should see the student and the student should see the teacher, and they remain enrolled in their current school. So whatever your school of enrollment is, that is where you still are considered a student, even though you're not there in brick and mortar, you're receiving your instruction from home from a teacher. Today we have about 10,000 students signed up for Duval Homeroom. And those students will remain students at their school, but based on our regional setup, schools are sort of collapsed together so that one, if we have a school that only has 15 students that are taking this instruction from home, it's not going to impact that school where the students are attending brick and mortar. If a school has over 50% of the students signed up for Duval Homeroom, we may very well be able to just use teachers at that school. But our goal is to ensure that students can keep their school of enrollment through Duval Homeroom. The other piece about Duval Homeroom is that you can come back at the end of the quarter. We ask parents to commit at least a quarter. So after the first 9 weeks, they might have more comfort with sending their child to school. At the end of the 9 weeks, they can send them to school. Through DVIA, again, that's a school by itself. If they wanted to come back, we wouldn't stop them, but they would have to unenroll from DVIA and then re-enroll into the school of their choice or enrollment.
And to that
a
point,
long explanation. Sorry.
No, and to your point, Dr. Green, will the hybrid model, if approved, will that be evaluated on a quarter by quarter basis, or will that eventually expire? How would that look moving forward if the spikes continue? And then with I know this is going to be asked, I might as well get it out of the way. With teachers, even if they're in the regional Duval Homeroom platform doing face-to-face instruction, will they be doing that from the building or from home?
Again, we're having that conversation
Okay.
with our union at this time.
Okay.
But the initial question you asked is, will the hybrid be evaluated? Based on the executive order, there's supposed to be a time frame that every district says we're going back to brick and mortar 5 days a week. Based on data from our district, that date again hasn't been set because it does rely on whether we're going to start school later. So I'm sorry I'm being vague, but a lot of this ties into the negotiations with the union that we're having right now.
Dr. Green, we understand that there's a slump, and if we can just pivot for a minute and talk about the education of reopening, we understand that there's always a summer slump with our students as it relates to the learning. Now we have the COVID, if you will, slump, if you will. As they transition back into school, how is that going to be addressed to make sure every student is brought up to speed?
Well, we are required to do a diagnostic, and that's part of the assurances for the reopening plan. And so students who will come to brick and mortar within the first 3 weeks of school, we will administer a diagnostic for all students to figure out, you know, do we have some learning gaps, the weaknesses, and if we do, how will we mitigate those weaknesses? But I think something that's more important is, are students really ready to come back to learning? They've been doing Duval Homeroom since March 23rd, and they haven't been back in the school since March 6th. So we need to deal with the social emotional parts of what students have been going through, what our teachers have been going through. So we have developed a social emotional curriculum and a 3-tiered support system to ensure, one, are children really ready to come back to what we're really all about, teaching and learning? If not, how do we address that? And if they are, then let's look at the learning gaps that may exist and how do we close those learning gaps? We also have brand new standards that we have to implement for our primary students and students in grades K through 2. So there's quite a bit that is still required from us as a school district to start the school year. And so the key for us is, how do we support our students that are in brick and mortar, but at the same time, those students who are on Duval Homeroom, we have to ensure that that instruction remains aligned and rigorous with what's happening in school. Because at the end of the 9 weeks, parents may feel very comfortable and they'll start sending them back to brick and mortar. And we can't have half of a group of students that are one place in the curriculum and the students that have been doing Duval Homeroom in another place. So it will be a balancing act on how we support families that are in brick and mortar and families that are participating through Duval Homeroom.
Mr.
so
Rogers,
much.
while she's on that, do you anticipate that grades will be factored back in this semester, with all that's going on, or this year, that they will resume doing the accountability grades?
Currently, that is the stance. The commissioner has indicated school grades will be applied this school year.
I did see that Vice Chair Anderson did join us. And so if Vice Chairman Anderson wants to just make remarks, we'll allow her the opportunity to do that if she so chooses.
Thank you all. Thank you so much for the acknowledgement. I am tuning in last minute here, and I'm just listening to the conversation, but I do appreciate the acknowledgement. Thank you all for having this conversation, to everyone that's participating.
Thank you so much, Vice Chair Anderson, for joining us. Mr. Manuel, I'm then turning to you, sir. Do you have a follow-up question?
I don't have a follow-up question. I basically like to say, are there specific things, Dr. Green, that you would want parents to know regarding communication and information about the opening of school? I recognize that a lot of the information is on the website. There are other kinds of pieces wherein parents can get additional information about opening of school, because I think that's going to be a critical piece.
Well, I hope that Thursday we'll have a resolution about how we're moving forward. And we have a communication plan that will be more aggressive at that point, because we want all of our families to know, well, when does school start? And many of them already know about registering for Duval Homeroom. As I stated, as of today, we have a little over 10,000 students already registered. But I know that sounds like a lot, but when you think about a district that's a little over 130,000 students, it's still less than 10%. And we just want to make sure that parents know their options and what is available to them. We will continue to share that information with our families. We also want parents to go to the website, because it has our safety protocols posted. Hopefully this time next week, we will have more protocols posted as it relates to the questions that came to me. What if a student is sick? What happens? What if a student has COVID-19? What does that mean for the class? All of that information, it's there, but it's a little nebulous. And I think this time next week, it is our understanding that the Department of Health at the state level is going to send us more guidance, so that the information can be more clear cut and easy for families to understand what it means if a student or if an employee tests positive. What does that mean for my child if they are attending that school in brick and mortar?
Thank you, Mr. Manuel. Dr. Hall?
Just a few questions. Dr. Green, have you guys been able to do any analytics with since March, from March until the close of school, as to the use of devices, not just participation, but highs and lows of utilizing devices, what areas of student population might have accessed online learning more than other areas? And if you've done any analytics, what did you learn from it in order to address online learning, for the fall? And lastly, what's the supply chain of devices? What does it look like for the district?
We have done analytics on our device usage We actually can do analytics on our hotspots. We can actually tell where students went on the internet with our hotspots. There are certain places that we started to lock down. Netflix became very popular, so we had to go in and say, okay, we're going to shut that off. They can't access Netflix. So we were able to determine that our high school students were our top users. Our high school students did not seem to struggle regardless of whether they were in a Title I school or a non-Title I school. And if they were seniors, they did what they needed to do to ensure that they were going to graduate on time. So the high school students, that is why we have a comfort level with the hybrid for high school, because high school students are techies generally, and they did not have an issue accessing their courses. Their issue was surrounding workload. Middle school was our next best user. And again, it did not matter whether they were in a Title I school or non-Title I. Where we saw our number one problem was elementary school. And it was very evident that in our Title I schools, it was very challenging to get those students to access consistently. Because we had the requirement that they needed to call every student every day, we were able to check in with students frequently. The problem was we could not keep them fully engaged online during what we would say are normal school hours. And for many families at the elementary level, they did not want their children on technology all day. So we, if you remember, provided paper packets for the first 4 weeks, and we had thousands of families choose that option because they didn't want their children online. But when the district stopped with the packets and then it went to school-based, it was very evident our schools of poverty had the most challenging time getting students to consistently engage on Duval homeroom without the calling and asking, students would maybe do the paper packet, but they would not engage on Duval homeroom. So that will be the same concern that we will have at the beginning of this year, regardless of whether families are signing up for Duval homeroom. It will be important when they have their orientation that they understand that Duval homeroom is a live instruction done virtually. So they have to be engaged. They can't do like in the fall. A lot of times teachers would record their lessons and students could access them later, especially high school students. They might be working during the day, and so later in the day they could access that teacher's recorded lesson. So we will have to work through that process again. Part of registering for Duval homeroom is we ask them, do you need a device? Do you need a hotspot? And so we will go through our laptop distribution once that registration closes, and we can determine how many students need devices, whether it's a laptop or a hotspot or both. And we will start the process of supporting those families who are choosing Duval homeroom. If the hybrid also moves forward, that's another phase that we'll have to work through, because even the middle school, if we're 7th and 8th are only going to school 3 days a week, there's 2 days a week that they're on Duval homeroom. And attendance will be important. We will need to ensure that that we follow up with students so that we can be confident that they're engaged with Duval homeroom.
And the district supply chain presently of those devices.
Well, currently, the only devices that were returned were for seniors and students who were withdrawing from the school district. So currently our students, if we gave you a device last year and you're not a senior and you're returning, they still have their device. They still have their hotspot. So again, we have an item, I believe, coming before the board in August that we feel that we will still be in a good place to support our students.
Thank you, Dr. Hall. We have exactly 7 minutes left. You know, I'm a stickler for time. And so I am going to go to Ms. Tooks, Ms. Gaines Holly again, Mr. Seabrooks, if they have any questions. And then we'll see if we can, because time has been well spent. So do you have a quick question for Dr. Green or Chairman Jones at this time?
Yes. Earlier you talked about the health department being a great partner with you all in planning and helping you with your plan with the hybrid. So there, you said they're in support, correct?
Yes.
If that be the case, the mismessaging that's going on from our governor and our Secretary of Education is that, as in one breath they're saying they're giving you the autonomy to do what you need to do as it works in concert with the medical community. If the medical community supports your plan, the hybrid of going or Duval homeroom extending throughout the year, when we go to appeal that decision with the state, it seems like to me you already have your foundation. You've already did your due diligence in securing support from the medical community. A lot of this conversation today has been with the mindset that most of us are returning our children back to the brick and mortar. But we have a percentage of parents, for a variety of reasons, particularly health reasons, that we want to try the homeroom. We like the homeroom concept. I wish we would have done a little bit more beefing that up over the summer in terms of training with our teachers, looking at what did we do good, what did we didn't do so well, and having some commentary about that, because I actually like that process. My issue, and what I hear from a lot of different parents who right now, regardless of what your decision is in terms of August 10th or pushing it back, that first 9 weeks to maybe the second 9 weeks, they want to do Duval homeroom. I want to know from you as our leader, how can we as parents, community support in speaking to our legislators, speaking to our governor, speaking to the Secretary of Education to say, it's not a matter of we're waiting to see if you're going to approve. This is what is right, because the school does not stand on an island to itself. It is a part of a greater community. And right now, our community is not healthy, period. It's just not healthy. So it doesn't matter how many protocols and wonderful things we got going on. If everybody is going back to an unhealthy community, we bring that into our school system. So a lot of parents are, and I'm getting texts even as we speak, of speaking to, if we decide to go to a home, if we decide to support a Duval homeroom, not the Duval virtual, which actually I think they need to beef up and have live classes as well. It's amazing that they don't have that like that. But the homeroom platform, how we can better support you in making sure that we can have that beyond Labor Day.
Well, I never would discourage anyone from writing your legislators, the governor, or the commissioner. The plan that, again, we have to bring it Thursday. That plan has to be approved by the Department of Education to ensure that our funding is not in jeopardy for Survey 2. And we believe the plan that we are in the process of developing will meet the threshold. The concern I have is anything beyond September. That's the concern for me. If you're asking me, my concern really is November. We continue to be told we're still in the first wave. What happens when, okay, we have a law and now we hit wave 2 and we're beyond, we're already in brick and mortar, we already have students in Duval homeroom. What happens then? And is that a time that we may go back to a stay-at-home order? We're back to locking everything down. Our teachers will be trained prior to the school year starting with the, I don't want to say new way we're doing Duval homeroom, but we learned from some glitches from the spring. And we figured out, okay, here are some things we need to do differently in implementing Duval homeroom. And one of the things that we said that had to be different was it had to be live instruction. It had to synchronize with the normal school day as if they were in brick and mortar. So we are training our teachers to be prepared, but we're also training another group of teachers who are who may be doing hybrid. So it's different because they actually do come to your class once or twice, for high school, twice a week. How do you do Duval homeroom for the other 3 days to keep that continuity? So again, I think what you could do as the community is write the commissioner and the governor and indicate that their executive order, the concern about the executive order, the mandate of 5 days a week, brick and mortar needs to be offered, and ask what would it take for them to change their stance. Now you have Chairman Jones and Vice Chairman Anderson. They are the political arm of this. My job is to ensure that I follow school board policy and state statute. And
I agree. And I'm glad you said that, because we do have 2 board members on. And I do want to know exactly when we're hearing today that there's a big lawsuit going on with the union, the teachers union. And so they're holding feet to fire. So we do want to know what our board members are, what your position is in not just being complacent with our government, but putting the lives of our children and our teachers, to stand and be bold. Dr. Green can't do that by herself. That is your responsibility. What are you doing?
So I believe that is the question for Chairman Jones. And let me apologize. We're going to 8 o'clock. I misspoke. I'm looking at the wrong flyer. So I apologize for that.
Mr. Rogers, I would say at 7:30 now.
I apologize. So we do have a little bit more time. Chairman Jones, I turn that question over to you as it relates to Ms. Took's question.
Well, first of all, let me say that we have to be very careful in this setting, because Vice Chair Anderson is on the line, and that's a sunshine violation if we discuss something that we may have to vote on in the future. So I'm hesitant to give us response because she's on the call too and can participate. So that's a sunshine violation. If we discuss anything that can be voted on in the foreseeable future, that's a violation without proper notice. That's a violation of sunshine. So that's my only concern.
Okay, so while I get that, as being on this panel and being a parent and in this community, I will say to you all, when you are in an environment where you can have the conversation, is that as a parent community, we're seeing, as we speak, lawsuits. We're seeing the discussion of other districts as large as ours who are truly fighting for the overall health of their faculty, staff, and students. We're seeing that conversation. Usually what the big ones do, we follow suit. So just know that we're waiting to see, are we going to stand in solidarity, even though I know we're in phase 2 as a community, but at the same token, we can write all the letters and we can do all of that, but our governing boards, we need to know, are you standing in solidarity of saying that we reject what is being handed down, because I guarantee you their children are not going back into somebody's brick and mortar.
Okay. I appreciate
So
that.
thank you for that.
Okay.
Thank you so much, Ms.
Ms.
Toots.
Toots. I know you are a parent and you are representing a lot of parents. And as the Honorable Jones said, he cannot answer things because there are 2 school board members on this Zoom meeting. But I would recommend that you go to the meeting on Thursday, hear firsthand, and they will probably let you speak to the entire school board on Tuesday. We hear you, and I appreciate your speaking out.
Yes, ma'am.
Okay, Mr. Rogers.
Thank you so much, Chairwoman. Ms. Holly Gaines.
Thank you. Glad to have Board Member Anderson out as well as join us. As we talk about, the conditions of our buildings and how we don't have the spacings here to be able to practice social distance in an effective way throughout many of our schools. How does COVID and the current conditions affect the push for the referendum? How do we see the implementation of that push going in the midst of this global pandemic? And a follow-up question to that, as we know, the overcapacity of schools, are there any plans in the interim to bring in maybe portables or some other type of setup that will allow for the proper social distance?
The schools that we had concern about overcapacity, Mr. Soares has already engaged conversations and has done walkthroughs with those schools. So for the most part, we do not believe we will need additional portables. If you remember early in the conversation, I talked about closing off common areas, such as places where people in the past, pre-COVID, could congregate. Well, now some of those areas have been converted to classrooms so that we can, again, add more locations for classrooms, especially at the elementary level, because the goal at the elementary level is to reduce their movement throughout the school. Unlike at the secondary level, because we're recommending a hybrid, all students aren't there every day. So that's giving quite a bit of relief. So let's go back to Sandalwood, 3,000 students, they have over 30 some odd portables. Well, because we're recommending students only coming 2 days a week, only half of the students will be there. So you'll have empty classrooms across the campus for Sandalwood to do some different things. And that's why we are pushing so hard to go with the hybrid.
And Board Member Jones, concerning the half-cent referendum and plans for that for the November election, how are we going to move forward with that in the midst of COVID?
Well, it's going to be on the ballot. We've already voted, and the City Council has approved to put it on the ballot on November the 3rd. So it'll be on the ballot, and we have a PAC, and we have consultants who are working a plan to make sure that voters know that it's there, and we want to promote and advocate for it. Dr. Green can inform, but we as board members, since it's already been voted on, we don't have to vote on it again. We can discuss that because it's behind us. That's something that we as board members can advocate for and ask our voters to support. It's very important. We have the oldest schools in the state of Florida, no question about it. Most of them are in the core city. And for the first time, I feel very good that we have a board that has really addressed, and a superintendent that's addressed the true needs of this community and not tried to spread it out all over, but really address the true needs of our community, unlike what we find happening throughout our city historically, where we ignore the real needs of our community. We had an engineering firm that analyzed and reviewed all our schools, all 157. And they came back and told us which schools had the highest FCIs, Facilities Condition Index. And based on that study, we put together a plan that I think addresses the true needs countywide, but especially addresses, when you look at the needs are clearly in the core city, and it addresses those needs in a way that I think we haven't done it before. If the city council had done that years ago with infrastructure improvement, we probably wouldn't have the many challenges we have in the core city today.
Thank you.
Thank you, Ms. Gaines Holly. Mr. Seabrook?
Yes, I wanted to ask Dr. I wanted to know, Doc, will there be additional laptops being purchased for classroom use?
We have an agenda item that will be coming to the board in August. We also have a board workshop where we will discuss our technology plan. But bottom line is, yes, the goal is to continue to add additional laptops. And it's not all about Duval homeroom. It's about technology is a way of engaging students. And what we found is that even though high school students can use technology, they really don't use it for learning. They use it to socialize, they use it to play games. They don't use it a lot for learning. And training is the only way that we're going to be able to push that forward. Mr. Rogers, if you don't mind, there was a question asked of me that if the decision was left up completely up to me, would I choose Duval homeroom or the hybrid? And I would like to answer that question if you're.
Go right ahead. Yes, ma'am, please.
Yeah. If there wasn't an executive order and there was nothing, that it was just a decision that was made at the local level, I still probably would push for a hybrid, because we have thousands of students who need brick and mortar. Whether we like it or not, we provide food, we provide breakfast, lunch, and for 90 of our schools, we also provide dinner. We have students who were already lagging behind pre-COVID, and really not sure how far they're now lagging behind because they have not been engaged in face-to-face instruction. I will always say that there is nothing better than a high-quality teacher engaging face-to-face with students. And if there is anything that would prohibit us from helping students gain additional learning, then I got to do everything I can to try to mitigate those situations, even in the midst of a pandemic. I believe that we need to do everything possible to make everyone as safe as possible. But we have some students, ESE students, that need their services, and it is very hard to deliver OT and PT virtually and not be engaged with students. There will be students that will be just fine doing Duval homeroom, and it has nothing to do with whether they're low income, high income. It has to do with some students. Again, like I said, technology is a great thing, but many children don't use technology for learning. And for some of our families, they're going to struggle. The families that both parents work, we need to be there for them. I have so much respect for our teachers. I will do anything for our teachers, but at the same time, I'm going to do any and everything for our students to ensure that we give them an opportunity to get back to school for a variety of reasons, but the number one reason is why we exist, for teaching and learning. But two, we're also going to make sure that we offer a high quality Duval homeroom. And if parents aren't comfortable sending their children back, then I want them to register for Duval homeroom. I want them to put down that they need a laptop, that they need a hotspot. We will get them the resources so that they can be successful with Duval homeroom. But there are some students that are falling further and further behind, and they need to see an outstanding teacher, which we have close to 8,000 of them. And I have no doubt whatever way we open up, that they're going to get in there and do their very best to support students. And we as a district and the board is going to do its very best to make sure we have those resources available for them.
Thank you so much for that, Dr. Green. And I hope that this next question does not conflict with the contract negotiations that's happening. So I'm gonna phrase it this way. What, and I'll say the same to Chairman Jones, what do you say to your teachers who are struggling at this time between going back in the building due to health and resigning their position because of the pandemic? What advice, what encouragement do you say to those teachers at this time who are struggling because they may have a pre-existing condition or because of health issues, things of that nature, and they're struggling? And as you stated, Dr. Green, we have some excellent teachers in our building who serve our students each and every day, and we applaud them. And we have teachers now, unfortunately, who are struggling in the profession as to what decisions do they make for them and their families. What say you at this time?
It's a tough situation to be in. We all are struggling through this COVID-19, whether it is struggling about coming back to work or I'm taking care of an elderly parent and want to make sure that I don't do anything to, jeopardize my mom. All I can say is they need to reflect and think deeply about the choice that they need to make. Teachers do have choices to apply for Duval homeroom and to teach through Duval homeroom. And, someone stated that, well, how will you feel when someone gets sick? I will feel the same way when one of our students gets shot and killed, like we lost a student yesterday. I feel the same way about anyone who gets sick from any other disease. I would feel the same way, heartbroken and devastated. But we understand that we have families that are depending on us. And again, each person has to make that decision for themselves. Am I going back to the classroom? Am I going to apply for Duval homeroom? Or am I going to make another decision? And I encourage them to counsel with their faith, to talk to family, to talk to friends, their significant others, to make that decision about what they need to do. As I said, we've been on Duval homeroom since March 23rd, and students haven't been in the building since March 6th. I have maintained my same daily routine of coming to work every day, coming into this building, attending graduations, going out to schools, interacting with people, but I also make sure I take all of the precautions. I wear my facial covering, I wash my hands a lot, and I do all the things to keep myself healthy and as safe as possible. And that is why we're investing the amount of dollars that we are to help make sure our staff and students can do the same thing if their choice is to be in brick and mortar. And it's not an easy choice. It's not, I would never presume that I know how it feels to say I have to go back to a classroom. I know how it feels to be a teacher, and I know what teachers do for our students and our communities. We're just now going to have to figure out how to do it during a pandemic.
Thank you so much, Dr. Green. Chairman Jones, if you want to respond to that question.
Yeah, it's a very difficult situation. That's what bothers us the most is that the teachers who have underlying conditions and are fearful to come back to class, parents will have choices. Many of our teachers won't have as easy a choice as the parents will have. Parents will have either Duval homeroom or brick and mortar. The teachers have Duval homeroom, brick and mortar, but for some who are not eligible for Duval homeroom, that's going to be a tough choice. I did speak to one teacher, friend of mine, whose sister is waiting on a heart transplant, and so he's been very careful about what he does because he's his sister's caregiver. He takes her to and from Mayo, and so he's concerned, and I understand that. But I wish the governor, or the president who wants to reopen schools would give the teachers that option to say, well, we'll pay you for X number of months for those who have verified underlying conditions or have a relative or a person they have to care for who wouldn't have to make that choice. They could stay home and collect unemployment or some type of subsidy until this pandemic is behind us or there's a vaccine for that.
Thank you so much, Chairman Jones. Chairman Jones, and this piggybacks on Ms. Gaines' Holly question that we got in. Is the board concerned that individuals will go to the polls November the 3rd and vote against the half-cent sales tax due to the reopening?
There are a lot of factors that we are weighing and how that will impact the vote. No one knows what that math is like. When we did the poll in January, February, it had a very strong approval rating. But since then, you've had the pandemic, you've had the effort to rename a number of schools. That could have a negative impact on the turnout. And of course, the reopening is controversial. So we have several controversies that all of which could impact the vote and the turnout for the half-penny sales tax. We're hopeful that people will focus on that issue and realize that at some point in time, we will be going back to brick and mortar, unconcerned about the pandemic at this time. And when we do, we want to have a 21st century learning environment for all our students. So hopefully we can get through this and the voters will understand the real need that we have in this community to address a long-standing problem.
Thank you so much. And if we only have 10 minutes left officially now. So I'm gonna try to get through a couple of quick, hopefully they're yes or no's. Dr. Green, if there's a student who's currently enrolled in the magnet school at this time, they elect to do DVIA, do they have a choice? Can they play, I guess is the question, can they play at their neighborhood school if they select DVIA and they're in the magnet school? Would that change?
Well, I guess I'm trying to figure out play.
I guess play sports at their neighborhood school.
I'm going to answer yes, that they can, because students can dual enroll, but I would recommend that they contact Tammy Talley, send her an email to either confirm or clarify my answer. I want to make sure that they get the absolute correct answer.
Again, for those of you who are tuning in to the NAACP and the Friends of Northwest Jacksonville Schools virtual town hall, we thank you so much for joining us tonight. We again have less than 10 minutes left. So if you have questions for our superintendent, Dr. Green, or Chairman Jones at this time, if you would input those into the chat box so that we can try to get to your questions at this time. I believe I have gotten to as many of your questions as possible, and they have been addressed throughout the conversation, which has been a robust conversation, great conversation. I will turn it over to our panel at this time to see if anybody on our panel, if you would just quickly raise your hand if you can get a quick question in. Okay, I see it. Thank you so much. Let me go with Ms. Gaines Holly. Again, we only have 5 minutes left, so we can get quick questions in. So again, we can end on time.
Quick question regarding the arts and the extracurricular activities, band, chorus, dance. How do we foresee those things continuing and being implemented with the COVID restrictions?
We have a program specialist who's working with all of our performing arts teachers to discuss with them the protocols related to COVID. Our number one concern is chorus and singing, because that is been shown that singing exudes more droplets. And so we will be working with our music and chorus teachers to discuss what we think they need to do differently. We've talked about having chorus, if you're especially at schools like Douglas Anderson, you may want to use your auditorium and make sure that you have the 6-foot social distancing mapped out in your auditorium. We've kind of talked to all the schools that if you have an auditorium and you want to use it as a class, that's great, but you need to map out the, close off the seats that students shouldn't sit in, and make sure you have that distance before you implement those types of activities such as singing. We already have the protocols in place for band. Like I said, we have band camp, cheerleading camp already happening, and they've already started implementing those protocols. So students now, they can't share instruments. They have to have their own instrument, whether they're going to rent an instrument or the school is providing them an instrument. The instruments have to be cleaned after every use. So we have protocols in place.
All right, Ms. Tooks.
Two quick things, and I would definitely, in conjunction with Ms. Holly, with Frank H. Peterson, and a little bit away from the arts, but in programming like culinary arts, we know with even in the restaurant industry, things are closed. Certain restaurants are closed down based on how they implement their food, like a buffet style or whatever. How does the protocols impact those culinary arts students or those other programmings outside of the, the special singing and all of that? And the second thing is not necessarily a question, but a comment. I just want to say that no matter what ends up happening, nobody's going to be completely satisfied. And I think that my prayer is that we're not selfishly looking just within our four walls, no more just us, but looking at the overall. So I just want to thank you and the board, our teachers, everybody, NAACP, the Friends of Jacksonville, for being engaged on this level, because at the end of the day, we all have to work in concert. We all have to support one another. But my question, going back to, again, like a school like Frank H. Peterson, how are we going to make sure that those kids are getting what they need? And do remember that we do have Fort Caroline that does not have the auditorium. And so they don't have those types of facilities like that. So how are we working with those schools to make sure that those kids still can continue in their program?
Well, no, Fort Caroline doesn't have an auditorium, but they do have other spaces that they could review as to this is where we will host our chorus, or you can only sing unless you have them outside so that you can have them far enough apart. But our program specialist for the arts is working with each school to help them design their protocols to ensure that I won't say it won't be diminished a little bit, but to ensure that they can still implement, but make sure they have those strategies in place. The same thing for Frank H. Peterson and A. Philip Randolph. We have our director of CTE working with those schools putting in, again, the protocols that need to be in place to support keeping the program viable, but at the same time, utilizing the strategies that we've indicated has to be in place at every school.
Okay, thank you.
Thank you. Let me ask this question, and I did not get a chance to really view it, but this is for anybody on the panel to address if you could. Can anybody comment on the lawsuit filed by FEA, the Florida Education Association, against the governor and the Florida Department of Education at this time? Anybody on the panel want to take a stab at that?
Well, currently the lawsuit is mostly for South Florida. The FE, the teachers union, I think, in South Florida. And the lawsuit is indicating the executive order that they don't have the right to tell a local body that you must open your schools up 5 days a week. The executive order that indicates that it can impact your funding. Those are the main pieces of the lawsuit that they're suing the governor and the Florida Department of Education, and that the local governing body should have the authority to determine how they will open schools. And just sort of a little bit off of that, when people want to know, well, why can Miami-Dade just open up virtual or Broward? And the reason that they are moving in that direction is because those districts are still in phase one. Phase one indicates that schools are not open. And that is what they are using as the stance that we can only open up through virtual means, because I think it's Miami-Dade, Broward, and it may also be West Palm Beach, that those 3 districts are still in phase one, whereas the rest of the state is further ahead.
Thank you so much, Dr. Green, for that. And this question came up, and I want to get to it. Pre-K, what about pre-K? How is pre-K being addressed or handled this year?
Pre-K is with the elementary, the recommendation of 5 days a week. They're currently, we are not actually allowed to do virtual instruction for pre-kindergarten. Their instruction is required to be face-to-face. And even though we see that we have individuals signing up for Duval Homeroom, we believe that that will not be true, because currently pre-K, even when we were using Duval Homeroom, we literally had to bring the materials to all of our pre-K children. We had to deliver materials to their homes because we could not have them on technology more, I believe it's no more than an hour a day.
Thank you so much. I am now going to turn, thank you all so much for joining us again. The time now is exactly 8 o'clock. Dr. Green, thank you so much for being here and answering all these questions. Chairman Jones, thank you, sir, for being here as well. I am now going to turn it over to our chair, Ms. Atkins, for final remarks and comments at this time. Again, thank you to our partner, Friends of Northwest Jacksonville, for your partnership and collaboration in this effort. We know and understand that there is a special board meeting happening this Thursday at what time is that?
1 o'clock.
What time? 1 o'clock. 1 o'clock. So this is fluid. So things are changing. And so with that, and understanding that in this pandemic that we're in, we look forward to continue this dialogue. With that being said, it's been an honor serving as your moderator tonight. Now I'll turn it over to our chair, Ms. Atkins, for final comment.
Well, Mr. Rogers, I think you said it all. I want to thank all of the participants, especially Dr. Green and the Honorable Lauren Jones. I want to thank Mr. Hank Rogers, Mr. James Morton for putting all this together, and all of the participants. all of the people who called in. And those of you who have questions, I know it changes from day to day, from hour to hour, usually from minutes to minutes. But just keep your eyes and ears open and pray. Thank you all, and we'll see you at a later date.
Thank you.
Thank you and good night.
Thank you. Good night.
We tend to, we like to keep our subscribers very hip on the latest fashions, to keep our girls fitness, of course, fitness, food, everything.